Symbolizes presents Desert AIDS Walk 2020. We step forward.
Hello, everyone. I'm Sandy Newton, along with our friend David Brinkman from Desert AIDS Project. Welcome, David.
Thank you.
So happy to have you here. And we are here to welcome you to a very special presentation of NBC Cares, kicking off 2 days of walking to support Desert AIDS Project. You know, when our community took their very first steps in the first AIDS walk back 34 years ago, they didn't know where we'd end up, but they did know that the only way forward was together. Well, this year is a little different, of course, because we can't gather in the park together before the walk. But the reason for the walk was never really about balloon arches or walker T-shirts. It's always been about the collective power of community and our shared vision of a future where everyone has the comprehensive care they need to live their best lives.
You know, we were founded at the beginning of the AIDS epidemic. And so people were losing their brothers. They were losing their best friends. Mothers were losing their sons. And so a group of people who were experiencing a lot of loss and a lot of fear came together.
That coming together is what manifested the first AIDS walk.
So our walk happened like walks all over the country. At first, it was a real radical movement of people coming out and actually wearing the word AIDS walk on their T-shirts. That was extraordinary at the time. It was an enormous statement. We have an opportunity to end the epidemic, but it will take all of us coming together in order to do that. And that's what the walk symbolizes, that we haven't given up and we're not going to give up.
And to embody the goal of AIDS being our history, not our future, community members come together every year to show their support. That is exactly why it is so important to fight to eradicate it. And that fight continues right here at the Desert AIDS Walk, where everyone participating feels empowered and connected to the community. Sponsors show their support, and the walk raises hundreds of thousands of dollars for the Desert AIDS Project to continue their everyday mission of supporting the health of every person in the Coachella Valley and their research to end the AIDS epidemic.
Because of your support, DAP developed the services needed to respond to the AIDS epidemic while creating a patient-centered model of care that enables persons with HIV to thrive. 34 years of walking created the roadmap DAP used to quickly open a COVID triage clinic, which has provided testing and respiratory treatment to more than 4,000 residents since the pandemic began. DAP is applying lessons from its past to today's crisis.
That's right, Sandy. Once you take that first step, the rest comes naturally. With AIDS and now with COVID-19, we chose to step up and step out of our comfort zone, making ourselves, the Coachella Valley, and our nation much better. It's that time of year again, and AIDS Walk 2020 is an exciting opportunity for everyone who cares about ending AIDS and opening health care for all to carry on that important and life-affirming tradition.
So important, David. You know, this year, the Desert AIDS Walk is a little different because of the pandemic, but the history of HIV activism is being heard loud and clear. The pandemic has accelerated change for every organization, but DAP remains committed to ending the HIV epidemic while it responds to COVID.
The AIDS crisis left unhealed wounds, and it's understandable that we may resist leaving our comfort zone. But AIDS taught us a community response is the most effective response. It taught us that we cannot turn our backs when communities are in need and in fear, that we must remember our humanity and the gift of giving back and be there to help. And as we've learned throughout recent human rights and health equity movements, equality cannot be experienced by one until it's experienced by all. By opening one of California's first COVID clinics, DAP made a choice to use its knowledge, fearlessness, compassion, and infrastructure to assist in a new challenge. We are survivors. Fear cannot rule us. When crisis sets in, we step forward. We refuse to be a deer in the headlights of life. With the ongoing courage and support of this community, our organization and mission thrives.
So true, David. You know, we are all so grateful to the generosity of all of the event sponsors, including NBC Palm Springs and our EntreVision family. Local IQ and our friends at the Desert Sun, Fred Noble and Wintech, Steve Tobin, Johnny Krupa and the Grace Helen Spearman Foundation, the Chandy Group, SoCal Gas Company, Gilead Sciences, AbbVie, Nonstop Wellness, Palm Springs Motors, and Palm Springs Disposal. Thank you all. You still have time to register, by the way. Just donate and walk. So go to desertaidswalk.org right now. A donation of any amount will support the vital work done at Desert AIDS Project.
At DAP, we believe that hope begins with healthcare. That's why this year's walkers will be wearing these masks to spread a message of hope across the valley as they walk.
So true, David. We could all use hope during these challenging times. So if you are walking or donating, know that you are humanitarians helping remove roadblocks to access to quality care and supportive services that allow DAP's clients, who are your neighbors and friends, to live their full potential. And the impact of your support is very tangible.
Thank you, Sandy. DAP serves 7,000 clients today. Last year alone, we provided 426 clients with housing, tested 4,300 individuals for HIV and over 1,300 for hepatitis C. Our on-site medical teams provided 5,000 dental visits and 7,000 mental health sessions. Every month, 80 new patients walk through the doors of DAP seeking quality and compassionate care. Because of you, those doors are always open. New HIV infections are rising, but the best way to help everyone protect themselves and each other is with free and accessible testing. Our testing teams meet clients where they are, in our sexual health clinic or out in the community, and we've helped people take control with 4,300 HIV tests. And a promise of support and care was given to 49 people after the news of their HIV diagnosis. Many people don't get tested for HIV because the prospect of managing HIV for the rest of their lives can seem overwhelming. But DAP has been standing by every person it has tested for HIV for 36 years. When it comes to linking those tested to meaningful medical and behavioral health care that improves health outcomes and reduces new transmissions, DAP has a 92% success rate. Housing assistance is part of our prescription. DAP helps clients into permanent residences because it's hard to focus on health without a roof over your head. Behavioral health and addiction treatment are included as critical components of DAP's primary care because if untreated, these issues get in the way of our patients' health. We helped 1,500 patients cope with depression and mood disorders in 7,000 visits. Substance abuse, especially with alcohol and crystal meth, disproportionately harms the LGBT community and people living with HIV in the Coachella Valley. We helped 712 patients address substance and alcohol issues in 2,300 visits. Good oral health is directly tied to better health outcomes. Patients took care of their smiles at DAP with attention from dentists and dental hygienists in 5,200 visits. Inequality is driving poor health outcomes for people of color and people living in poverty, especially when it comes to information about medical care. That's why we brought our collection of patient literature onto our website with our Community Health Resources page. Offered in English and Espanol, topics include COVID, HIV, STIs, transgender health, hepatitis C, and more.
You'll remember, David, that before the pandemic, we were able to visit you, and it was such a treat to take a look at the new blue and green clinics. Take a look.
So you're getting a sneak preview of our soon-to-come Blue Clinic, and we are in the huddle space 7:45 a.m., all the clinicians and the interdisciplinary team, psychologists, pharmacists, social workers, nurses, clinicians, are reviewing who's coming in today.
The vision of creating a new state-of-the-art patient-centered medical home alongside the existing DAP facility has finally come to fruition. Many years in the making, doors will finally open in March, welcoming all Valley residents, men, women, gay, straight, trans, insured, uninsured, to the patient-centered medical home model of healthcare. This new concept gives care teams a chance to do more for their clients' health, thanks to better technology for communications and more client input.
I mean, it's great for patient experience. Think about it. You come in, you're having trouble getting your prescription filled. We've got somebody that'll help with that. You've got problems with the referral process and it takes too long and you need to get, and we can move that up and we can work on that as a team.
The new clinic setups are designed to enable clinicians to get to know their clients better so they can personalize their experience and facilitate their understanding of care, but it's so much more.
First and foremost, it's a community in action, which is part of DAP's DNA, is finding unmet needs in the community and responding to them.
I've practiced over 30 years, and it's been sort of one doctor, one nurse, one office takes care of a patient. This is a whole team of patient and resources that can help with the patient.
I feel so blessed that I'm a part of the mission of Desert AIDS Project. It provides my life ultimate purpose. And I can't imagine doing any other work. I was born to do this.
You know, Desert AIDS Project has a very long working partnership with Desert Regional Medical Center and Tenet Healthcare. We're joined now by Linda Evans, who's the Chief Strategy Officer. We're going to learn a little bit more about how these two leaders in healthcare have come together to care for our community. Welcome, Linda.
Thank you, Sandy. So happy to be here with you.
So happy to have you. And I know that Desert Regional has a very long history of caring for persons with HIV.
Absolutely. And our partnership with Desert AIDS Project has lasted for years, actually, not only as the presenting sponsor for the annual Desert AIDS Walk, but just walking side by side with them in caring for persons living with HIV/AIDS. In the early 1990s, when our community was filled with uncertainty about HIV/AIDS, Desert Regional Medical Center, then Desert Hospital, responded to the healthcare needs of our neighbors. And in 1995, the year that AIDS was the leading cause of death in America among people ages 25 to 55, a group of dedicated volunteers at Desert Regional, led by the late Guy Lawson, worked with the hospital to transform the third floor of our East Tower into a home away from home for the very seriously ill in our hospital's special care unit. This was through unique interior design of the patient rooms. Thankfully, the need for inpatient palliative care rooms that were provided in our special care unit back then has subsided, but the hospital's commitment to the community and to eliminating HIV/AIDS continues.
Thank you so much, Linda. Appreciate all the information and you being here and your support as always.
Thank you.
There is so much going on at our Desert AIDS Project. A very important new component of the excellent care has now become research. DAP is one of only 22 facilities currently providing crucial information for many prestigious studies. This is the Doc. The facility welcomed its very first clients in March of 2015. It's a sexual health clinic for men and women, open Monday through Friday, 8 a.m. to 5 p.m., and offers free and confidential HIV testing. It's available on a walk-in basis with no appointment necessary, and its benefit to our community is immeasurable. In addition to yoga and meditation, another key resource available at DAP is behavioral care. So between the important new research, the Doc, PrEP counseling, and behavioral care, and now their new patient-centered care model, DAP is committed to ensuring all of us living in the Coachella Valley, with and without HIV and AIDS, are able to lead healthy and happy lives. Well, you know, it's not just the walk that's virtual this year. The Health and Wellness Festival is also going online in a space that you can enjoy from the comfort of your own home. To tell us more, we're joined by Laura Dunn, who's the manager of the Walgreens on-site at Desert AIDS Project. But first, if you want to know how to explore the Health and Wellness Festival presented by Walgreens, please visit www.desertaidswalk.org and click the link to the Virtual Health and Wellness Expo. You can visit visit the booths for dynamic video experiences offered by our sponsors, as well as DAP's various programs. So welcome, Laura, and thank you so much for being a good example of wearing a mask. Of course, Walgreens would set that example.
Thank you for having me, definitely.
Appreciate it so much. And you know, I know Walgreens has such a long history of being involved with DAP. Tell us the background of that.
So it's a long partnership that we've had. DAP is an inspirational healthcare provider to the community, which we're proud to partner with and work closely with. They provide, as you already probably know, they provide numerous services to the community, not only primary care, but dental care, behavioral health, preventative services, and social services. Our history is long-running for providing care together for the community with our stores throughout the Coachella Valley and the Inland Empire. My store in particular is actually on-site at DAP, which gives us a unique opportunity to work directly with the healthcare providers and provide the highest level of care to our patients.
That's so excellent to know. And so tell me specifically what you do provide on site at DAP.
So we partner with DAP for a lot of our services. One of the important aspects of our partnership, I think, is the daily staff meetings that we attend so that we can connect with the other healthcare team and stay up to date on anything current that's going on with DAP. Another main focus that we have is our adherence for our patients. This allows us to make sure that the patients are taking their medications appropriately and as directed by their clinicians. It also allows for us to monitor and address if they're having any side effects to their medications. It's very nice because some patients who may have fallen out of care, this program I feel like has really helped kept them in care with their medications and with the clinic.
Yeah, the accessibility and convenience is so important, isn't it, in patient care?
Definitely, and that's why it's kind of nice that we have our sister stores out in the community that have the longer hours, the 24-hour stores, the drive-throughs, so that, and we're all connected, so that if they're not able to make it in to see us specifically, they can go out and go to a store maybe closer to their home.
Well, we thank you. A great partnership between Walgreens and DAP.
Thank you. Thanks for having me.
You know, our community really appreciates Walgreens' amazing support of DAP. And if you would like to explore the Health and Wellness Festival presented by our friends at Walgreens, you can visit desertaidswalk.org and click the link to the virtual Health and Wellness Expo. You can visit the booths for dynamic video experiences offered by our sponsors, as well as DAP's various programs. Definitely check it out. And if you're walking the traditional route, it's been mapped out for you and available for download. You know, there are plenty of opportunities for walkers to take selfies along the routes and more stops along the way to say hello to all of our local businesses or share a message of hope through social media. Let's take a look.
And I'm in downtown Palm Springs to tell you about a very exciting event, the Desert AIDS Walk, virtually this year. And joining me is Stephen Hankey today, because we're going to show you some extremely cool places to stop during the walk. This is just one of the routes you could take, but we're going to show you a lot of cool places. Hi, Stephen.
Hi.
I'm so excited for this. A lot of these monuments I've never even seen myself, so I'm excited to show everyone just how selfie ready they can be for the walk, even though we're going virtual.
I think that's great because, you know, you're normal. A lot of people have never come down to Palm Springs. We've been in this pandemic for 6 months. A lot's changed. We've got so much new public art to show the community and for the community to take great selfies and update their Instagram and spread joy and hope all across the valley and to their friends and family across the country.
Right, and this is one of them.
Yes.
Greetings, perfect way to start our walk. Greetings to everyone. All right, you ready to show them more, Stephen?
I'm ready.
All right, let's go.
Sits right next to
The babies.
famous babies.
That's right. All right, let's check out what's next.
Yeah, this is the dream of Nona Watson from the Palm Springs Chamber of Commerce. This is the Chamber's tagline, P.S. I love you, and she's lent it to the city.
And look, another destination, Stephen.
Another Instagrammable moment.
Yes, desert glow. We're all getting that desert glow right now. Yeah. Oh, thank you. Thank you. Okay, Stephen, it may be October, but it is still hot out here. We should take a little break and upload our photos.
Luckily for us, there's more public art, another photo op, and we can sit right on here.
Yeah.
And use the hashtag for Desert AIDS Walk, which is DAW.
DAW. Hashtag DAW 2020.
We'll share it with all of our friends, share our hope, share our joy, and spread the love.
We got a lot of pictures, Stephen.
Oh my God.
Love them.
To tell us more about the work at Desert AIDS Project, we're joined now by DAP's board chair, Patrick Jordan. Welcome, Patrick.
Thank you, Sandy.
You know, I know that you've been on the board for quite a while and involved in so many fundraising events. Tell us what's going on now with Desert AIDS Project during the pandemic.
Well, DAP knew that the COVID pandemic would impact underserved communities harder than others because we saw it happen to the LGBT community at the beginning of the AIDS crisis. We knew that access to health care would have an impact on how community members responded to the pandemic, and we now know that health care equity leads to fuller equality. Our team quickly opened a COVID-19 triage clinic on the DAP campus, and to date, we've tested over 4,000 community members for the virus. We immediately saw negative impacts of COVID on the clients we support as they continue to be disproportionately affected by HIV, poverty, and racism. We provided no-charge COVID-19 antibody testing and educational materials from inside the DAP mobile testing van, choosing a time and place where we knew the community would be already gathering for FIND's free community mobile market food distribution day, which is at the James O. Jesse Desert Highland Unity Center. COVID testing was important, but we also helped many learn about our culturally competent care offerings, and we even enrolled some people into primary care. We plan to develop our mobile testing and outreach even more.
DAP has also remained focused on ending the HIV epidemic, with their community health team responding in innovative ways.
Counselors at our recovery centers and treatment facilities in the Coachella Valley are accustomed to experts from DAP visiting them to conduct HIV testing, treatment, and education on site for their clients. When our community health personnel had to stop in-person events, we didn't let COVID-19 get in the way of our HIV testing for those who need it at recovery centers and treatment facilities. DAP has provided 500 HIV self-test kits for these facilities and treatment centers, preventing dangerous delays in HIV testing. When we noticed increasing HIV at a time when patients say they are afraid to leave home, we brought testing tools to them via mail. By providing confidential and free testing with the option of guidance from a DAP team member, we are keeping our promise to fight HIV in the Coachella Valley.
And for all of DAP's other patients, this is how DAP has protected their continuing of care while social distancing.
Before sheltering in place was an order, DAP's IT department activated its what's called a telehealth plan, using MyChart's virtual visit platform and to some extent telephone consultations. Thanks to planning ahead, the technology rolled out happened quickly, and no medical or behavioral health services were cut to patients. By logging in from the comfort of home, DAP's patients experience that continuum of care, essential for living with issues like HIV, diabetes, and severe depression.
And we know that COVID has had an economic impact too, shuttering some local businesses and leaving many in our valley unemployed and without health care insurance. So, Patrick, tell me a little bit about the insurance situation.
When unemployment in the community was projected to climb to almost 30%, almost overnight, we knew the chaos of losing health benefits was only the beginning of hardships that our patients will face in this crisis. All of those are dangerous to public health, but with one call, patients obtained insurance or Medi-Cal through Covered California in about 1/3 of the time that it usually takes.
Thank you for joining us for this very special kickoff to the 2020 Desert AIDS Walk.
Thank you so much, David. We hope you're going to consider supporting DAP by registering or walking. And of course, we want to thank all of our sponsors for this year's walk, and we'll see you at the virtual finish line. Oh, but wait, before we forget, it's a tradition that not even a pandemic could end. So to kick off this year's walk, we're joined by 40 members of the Palm Springs Gay Men's Chorus who created a very special performance for us via Zoom. Enjoy.
When the waves roll on over the waters and the ocean cries, we look to our sons and daughters to explain our lives. As if a child could tell us what, as sure as the sunrise, sure as the sea, sure as the wind in the trees, we rise again in the faces of our children. We rise again in the voices of our song. We rise again in the waves out on the ocean. And then we rise again.
When the light goes dark with the forces of creation across a stormy sky, we look to reincarnation to explain